With the aging process of all of us and our pets too, we run into certain disease situations that are more prevalent than others. Primarily I want to just go over one particular one with cats. The top three disease situations in aging cats that we see. Number one is kidney disease, pretty close followed by hyperthyroid and diabetes. Diabetes is down the list. One I see quite often though is hyperthyroid. And what does that mean? That means the thyroid is overactive in cats. It is caused by a benign, a non-cancerous tumor in the thyroid gland itself. Now, how would you know if your cat has hyperthyroid? Usually it's a disease of older cats. The age of around 11 is around the median age what we see it. 13 is where for some reason I see a lot of cats. It just seems to be that's when they end up in the clinic with the signs that we see. Things that you would notice if you're concerned about your cat having thyroid issues is number one, you've got a cat that has got a very, very good appetite and is constantly eating. No matter how much it eats, it will continue to lose weight. They're usually very thin, they're very wiry, you can feel their structure, their muscular structure, their muscles are very tense, they're very needy, they're looking for attention or looking for something to do. They get bored very easily, so they're going to be investigative, they're going to be active, and actually to a point where they're overactive, and even to a point where it can be very annoying. Vomiting and diarrhea are another thing that goes along with it, because with hyperthyroid it can cause some serious issues, because if they're having vomiting and diarrhea on top of being very energetic, to keep normal weight on them is a very, very big challenge. They also drink a lot of water, so that makes us think about the possibility of diabetes or a urinary tract problem, or a lower urinary tract problem, or even kidney problems. The other thing that we do see that it does cause is it causes heart murmurs and can cause some specific heart disease. And that is an issue as cats older. So we have heart disease, and we can potentially predispose us to some kidney disease because of blood pressure. This thing gets complicated very quickly. The causes, really, we're not exactly sure, but some of the literature points out that cats that have eaten a lot of canned food all their life is one possible reason for increase in hyperthyroid situations. And in environments and countries that don't have canned food, where cats are basically fed from the table or whatever they catch, they have a dramatically less chance for hyperthyroid than the domesticated cats that are on the wet food. This is still not a 100% guarantee that that's the cause, but it's one reason that has been examined very closely. Going forward, the diagnosis and treatment, diagnosis is made by blood tests. We actually do thyroid testing and thyroid panels. Depending on if it's above or out of the range, then there may be a confirmation panel that is run just to make sure that that's what we're dealing with. And we actually treat it with medications that suppress the adrenal gland. They're actually used to destroy or reduce the amount of tissue of the thyroid gland, because it is a non-cancerous enlargement of the thyroid gland, which increases the volume of that thyroid hormone that becomes the problem. So if we reduce the amount of that thyroid gland through medication, then we will have more of a normal thyroid production, and these individuals will hopefully calm down in life, start to eat and put on weight, not be so hyperactive, and live a more comfortable time during the last few years that they have. But again, it's an older age disease in cats that has issues with heart disease, potentially kidney disease. It is diagnosable and is treatable, but it is one that has to be seen by a clinic. So if you have cats that exhibit any of these signs, I would strongly recommend you have your regular veterinarian check them.